Let's get right into it. The OET reading section isn't just another English test. You have to think of it as a professional skills assessment. It's designed to see how well you can process information in a real, English-speaking clinical setting.
So why is it set up this way? Well, because it's built to feel like your actual job. It's not really about whether you understand every single word. It's about how you, as a healthcare professional, use information to make quick decisions. Like when you're scanning a patient's chart for key info right before you walk into the room.
It all boils down to three core abilities. First, can you pinpoint specific data fast? Second, can you tune out the noise and grab only the critical details? And third, can you figure out the intended meaning from complex medical language? These aren't just test skills. These are things you do every single day at work.
Okay, so how do they actually test all this? Let's pull back the curtain and look at the structure of the test itself. Here's the full blueprint for the reading section. Here's the big picture. Take a quick look at the total time, the three different parts, and how the questions are split up. We're about to dive into what these numbers really mean for you. So the clock starts with 60 minutes, 1 hour. But, and this is a huge but, that time is not divided up equally, and that's where things get interesting. And in that single hour, you're going to face 42 questions. Right away, that should tell you that your pacing is going to be absolutely critical. So what's the magic number? What are we shooting for? Well, to pass, you need to get at least 30 of those 42 questions right. That's our target. Keep that number in your head. Now, this is maybe the most important thing to understand. The test is really two completely different challenges packed into one. You've got part A, and then you have parts B and C. You cannot approach them with the same strategy. Let's put them side by side. Part A, that's an all-out sprint. We're talking 15 minutes to fly through 20 questions. It's all about speed and just grabbing the information you need. But then you hit parts B and C, and you have to completely switch gears. This part is more like a marathon. You get 45 minutes for 22 questions, and they're testing your ability to really understand details, main ideas, and opinions. Let's zoom in on what that feels like. In part A, you'll be working with 4 short texts at once, doing a mix of matching, short answers, and fill in the blanks. For parts B and C, though, it shifts to longer texts, and you're dealing with multiple choice questions that require much deeper comprehension. And look at this chart. It tells a critical story. Part A has almost half of the total questions, 20 out of 42, but you only get a quarter of the total time to answer them. This is huge. It means mastering Part A isn't just a good idea. It's pretty much non-negotiable if you want to pass. So let's put Part A under the microscope. We're calling it the speed challenge for a reason. It's a pure, unfiltered race against the clock. It's designed to do one thing: test how quickly and accurately you can scan for information. So what will you actually be doing? Well, you'll get a set of 4 short texts. Your first task is to match bits of information to the correct text. Then, you'll dig into those same texts to find specific details for some short answer questions. And finally, you'll fill in the blanks in a few sentences. It all happens very, very fast. Let's just do the math for a second. 20 questions in 15 minutes. That comes out to less than 45 seconds per question. Let that sink in. There is absolutely no time for slow, careful reading. You just can't do it. And this quote right here, it just hits the nail on the head. Success is all about efficient information handling. It's not about deep reading. It's about finding what you need and moving on. Think of it like this. You're on a busy ward and you need to find a patient's allergy information now. You scan the chart, you find it, you move on. That's the mindset for Part A. And this focus on raw efficiency is exactly what makes the OET reading test so different from other English exams you might have taken in the past. So here's the fundamental difference. Tests like IELTS or TOEFL often test your general understanding after you read a lot of text. But the OET, it's all about your method. It's not testing that you can read English, it's testing how you read it. How quickly and accurately can you find exactly what you're looking for? And this brings us to the bottom line. Having a great command of English is definitely helpful, but honestly, it's not enough to guarantee a pass. To do well on the OET, you have to specifically train for it. You have to master the skill of scanning. So ultimately, the one question you need to ask yourself is this: are you reading like a clinician? Quickly, efficiently, and always with a clear purpose? Because that's what the OET reading test is really all about.